achieved so far as an organization?
Yeah, the organization, it was formed in 2013. That was November 15.
Yes.
Yes. After that, in 2015 March, the organization was launched at Cairo Hotel. It was launched by Mr. Philemon Kapirima, the one who is acting director, Human Rights, Minister of Gender, on behalf of Given Ruvinda. So after it was launched, we did a number of donations. Our first donation that we did were supported by Protea Hotel Cairo Road, which was the first organization that supported our mission and vision of helping the most vulnerable patients in the hospital, where we went to the University Teaching Hospital and we had donated beddings. That was G12.
Yes.
We had donated a lot of beddings and other basic needs, the soaps, the tissues, the dishes, all those are basic needs that a lot of people need.
Yes.
And how do we usually donate? The way we usually donate, we usually get into a low-cost ward and then donate to almost everyone, and then start interviewing patient by patient, because they might have some other needs, not only the one that will be donating, but there are other needs that will need. So then we'll be able to interview them and then know what they need, then we'll add other stuff that we need.
All right. So how are you attracting other social organizations like in the society to come on board and join you in the quest of helping the vulnerable patients at the University Teaching Hospital?
Yeah, what we have been doing, we have been using Facebook as a social media,
Yes.
to be posting stories about the need of helping those people in the society, those who are extremely suffering. And we have been writing to almost, I can say, about 90% of the organization in Lusaka. These manufacturers, we have written to hotels, we have written to banks, we have written to individuals. We have given them the profile about what we do to save the most vulnerable in the society.
And how has been the response?
The response, it has been extremely, extremely
not so good.
Not really so good.
Okay.
It's like most people, they are not really that interested into helping the most vulnerable. That's one thing that I know. Only few organizations came in that really helped us. We had a number of organizations going up to 9. The first organization, which was Protea Hotel, then from there we had JCTR, which is Jesuit Center for Theological Research. Then we had Oriental Quarries. We had Fairview Hotel. We had the Ratson Brew Hotel. We had one church, which is United Family International Church, which is along Double Mbeki Road. It also came in. Then what else? We had the total went up to 9. Then we had also Unilever. It's one of the organizations that came in to help.
Yes.
And then I think we had a number of organizations.
But that was impressive as well.
Yes, including the embassy, one of the embassies, which is the Irish embassy. It's one of the organizations that came in, and it supported us for our vision and mission. At least we had a number of organizations which went up to 9 since we started our operation. Since the organization, when it was formed in 2013, we started doing some donation. That was 2014 up to 2016. At least we had really did a very big job, and we still really thank these people who helped us to achieve our vision.
All right. What are your future plans here onwards now?
Yeah, our future plans, we want to come up with a donation center.
Yes.
Yeah, but we have already found a container at Kawata. But we are looking at a strategic place where if we put a donation center and we go to radio station, we go to TV stations, people will be able to donate. We haven't yet found a good strategic place where that container can be put, so that at least different things can be donated that can really help those people in the hospital. Then apart from that, we are also have a plan of coming up with a house near the University Teaching Hospital, as those people have been given appointment maybe to come after 2 weeks, to come after 1 week. At least they can be resting there into that house until they go back to their medical attention. Then maybe some of those people who have been discharged, maybe they need transport money. At the moment we don't have transport money to give them, or we have written to other organizations that haven't responded. At least they can be resting, where we can try to write to some few organizations in terms of food, so that those people at least they can feel good. Sometimes people want to make maybe boil hot water. They will just go to that house, then they boil, that kind of thing. So that's our plan for this year, coming up with a donation center, and then coming up with a house that will be keeping those patients before going to the actual place after the transport has been found. Those are, then apart from that, we want to link ourselves to big NGOs like the NGOCC, the Society for Poverty Reduction, Action Aid, Global Platform, all these big organizations, because our organization is just a small organization. Though we started in 2013, we haven't yet found some funders who can help us, but we have been volunteering with this organization, and things are really moving. We've got good strategy. We are really happy about the organization.
All right. Okay, Mr. Iramba, we have come to the end of the program, but as you know, today we are celebrating Women's Day. Your message as an organization to the women out there?
Yeah, what I can say that you celebrate nicely this Women's Day. It's a very good day which was chosen to you women, so you really have to be happy today, as it is your day. And one last message that I need to give to the viewers is that we need to start thinking about the most vulnerable, especially us Christians who usually go to church. The way we go to church is supposed to be the way we should also help those in need in the society. It's not just about going to church on Saturday or going to church on Sunday. No, it's about helping, practicing that love that we usually go to church. It's supposed to be there even out in the community, so that the vulnerable people, they should feel good that there are people who love them. So I'm asking for corporate organization, individual, all those who have got that love to come and partner with us, so that we can start helping those people who are really extremely suffering in the hospital, coming from DP villages without family support. Some with family support, help those people to go to different countries where they're supposed to be operated, because we don't have adequate equipment because of their chronic illnesses.
Okay, all right. So we have come to the end of this segment, but the round still moves on. There are